Nicole Jones from TechSoup, and I'll be your host today. So before we get into today's content and introduce our speakers, I want to do a little housekeeping on how we use the webinar platform Global Meet. So all lines are muted, but if you have any questions today, you can add them to the chat box and also ask your questions within the webinar platform. If you lose your connection, no worries. You can reconnect using that link that was emailed to you. And lastly, you'll receive an email with this presentation, recording and all of the resource links that we mentioned today. You can go back and watch anything you might have missed. And we also really recommend that you share this with friends and colleagues. So getting engaged is highly encouraged. We'll be asking you questions throughout this webinar, and your engagement is super important for us and the nonprofit community. So you can do this by engaging with us and chatting your responses within the chat box of this webinar platform. You can respond to poll questions that we'll be asking throughout the webinar and after as well. That post-event survey is very important, so please stick around. That's really going to help us make content decisions for future webinars, and especially on this topic, so please make sure to answer that. And you can also tweet at us at TechSoup and use the hashtag TSWebinars and COVID-19. You'll see it throughout the webinar slides if you need a helpful reminder. Okay, so now that we have that covered, I'd like to share a little bit more about who we are. So TechSoup is a global network bridging tech solutions and services for good. More than 1.2 million nonprofits in 236 countries and territories have benefited from TechSoup and recognize TechSoup as their unique resource platform. And this is made possible with the support of more than 100 corporate donors and providers of software, hardware, and services who have chosen the TechSoup platform to create and grow impactful in-kind donation programs. So you can learn more about these great offerings that change makers like yourself can take advantage of by visiting our nonprofit tech marketplace at TechSoup.org/get-product-donations. We're going to include that link in your chat box in addition to other links that you hear, so don't worry about having to write those down real quickly. We'll have those handy for you in addition to the post-event email. And you can find a lot of these tech tools for managing remote workers that we'll discuss today in our marketplace, and you'll be hearing more about them on social media as well. So make sure you follow us on social media if you don't already. But TechSoup, we're much more than just this tech marketplace I mentioned for getting those great deals on software and hardware for a nonprofit. We also offer online and offline communities to foster collaboration and peer learning opportunities, in addition to useful tech resources and tips through TechSoup's free blog, webinars like this one you're on today, forums, and articles. That, in addition to our Apps for Good division, where we collaborate with experts to create and curate relevant solutions that help communities around the world. And with that, now on to introductions. So on today's webinar, we're joined by Marnie Webb. She's the Chief Community Impact Officer for TechSoup, who also leads Caravan Studios, a division of TechSoup. In her role, she works with communities around the world to describe desired impact and to develop technology solutions that help them move toward that impact. And we're also joined by Cameron Jones, who oversees TechSoup's development of innovative solutions and services and solutions for the global nonprofit sector, including IT consulting and management services, TechSoup courses, and hardware programs. And they're joined by me. I'm your host, Nicole Jones, in addition to Stephen Davidson, who will be assisting our chat. And with that, I'd like to welcome Cameron and Marnie. Thanks for being here with us.
Thank you, Nicole.
Thank you.
So, hi, everybody. Good morning, good afternoon, good evening. As Nicole said, I've been watching the chat as everyone's saying good morning, and it looks like we have people from not only all across the United States, but we've got people logging in from the Philippines, and I think I saw Greece go by, and Poland, and Ireland. So welcome, everybody. This is really exciting. So our aim today is to give you nonprofits the capability really to adapt as rapidly and as securely as possible to the current situation with COVID-19. And so we're going to talk about some approaches and tools that you can use that will support you in some of these approaches, in some of these thoughts and ideas that we have today. So as Nicole mentioned, we are going to be asking a little bit for your thoughts and feedback through polls and online questions. I do want to clarify up front that we cannot answer any questions about liability or legal issues. You will have to take those to your own legal advisors to get feedback on. So just wanted to lay that out up front. So one of the really critical aspects of preparing for and responding to a crisis like the current COVID-19 pandemic is getting your facts straight. And as is the case in any disaster scenario that we see organizations deal with, there's always a lot of misinformation and disinformation that runs around out there. So we at TechSoup have been using the World Health Organization and the CDC as reference points for both data and guidance as we've been making decisions for our own organizations. And this map obviously is from the World Health Organization. They have been a great source of information and guidance for us as we've made our own decisions. And they put out every day they put out a daily situation report, and this map is obviously from yesterday's daily situation report. And these reports are really, not only do they have a lot of data about kind of the current situation, but they also often have as part of them something called a subject in focus or an overview. It's kind of an overview or Q&A that deep dives into a very specific topic related to the COVID-19 situation. So a couple of days ago, they had a deep dive subject on the difference between COVID-19 and the flu. They have sections on mis and disinformation, health equipment, that kind of thing. So great source of information. And because everything is changing so rapidly, obviously it's important to have consistent sources of information to turn to. Also the CDC, for those of us in the United States, also for any of you located in other countries, you're going to have local or national health agencies that are going to be issuing guidance. So that's like for any organization looking for information, those are kind of the best sources of data for you. So question number one, let's kick this off with a quick poll to understand what kind of nonprofits are on the line today. So if you could, I think, Nicole, I think you're putting up a poll now on what kind of organization are you in terms of what is your mission area?
Yes, just launched, and I see results coming in. Just take a few more moments.
So I'm seeing lots of human service organizations, followed by art education organizations, look like they're next, and other public and social benefit. That's great.
Great. All right. I'm going to close it out.
All right. So, of course, many types of organizations will have different plans for how they react to the situation and different approaches depending on the kind of organization you are. And I'm now going to hand off to my colleague Marnie, who has been part of TechSoup's own team that is making decisions about how we react to the pandemic and has some great guidance for how to approach this.
Hi, everybody. Thanks, Cameron. So as Cameron said, I've been a part of TechSoup's task force, which is one of the things that we're going to be recommending in the course of this call, which is a group of people that are coming together on an as-needed and regular basis, both. So we have regularly scheduled calls, but also if something emerges that requires us to have an ad hoc meeting, we're all prepared to do that so that we can go through all the different things that we have to decide to help TechSoup respond. And one of the things that we have been thinking about as we put this together is how we keep ourselves sort of focused and not overwhelmed by the amount of information coming into us. And one of the tools that I have found over time that is helpful to support this kind of decision-making is something called the OODA loop. You see it on your slides there. It actually comes from the U.S. military, the Air Force, I believe, and yet still I love it. It starts off with observe. You look at your surroundings and see what's going on around you. Cameron pointed to some good places to look at. Certainly that's what we're using, guidance from the World Health Organization, the Center for Disease Control. We're also looking at information in the different states and counties, particularly where our offices are located, guidance from countries in which we have offices outside of the United States. And then keeping those things in view, while of course we're all seeing news from a wide variety of sources, including social media and traditional journalism like the New York Times, we're still trying to balance it so that we're able to observe and then go to the next step, which is to orient. And, you know, that's really saying, okay, given the situation and the view that we have of the situation around us, what is it that you do and what is your stance? So when we oriented ourselves at TechSoup, for example, we decided that our goal was to obviously keep our staff as safe and healthy as possible while continuing to provide services. So we looked at what was around us, and then we said, okay, what do we have to do to orient ourselves towards that goal? And that's when we decide. And then once you decide, you act as quickly as possible. So once we decided we needed to be prepared for our staff to be able to work remotely, we started putting that in place as quickly as possible. We have many staff members, for example, that use desktop computers, and they're answering help desk phone calls from people around the world, actually. And so we had to put the things in place to be able to allow that staff to work from home and check in around staff. And then you start all over again. You say, okay, we've made this set of decisions. It's time to observe again because the environment around us is changing. We all know this is a rapidly changing situation. But also things change because of our decisions. So once we decide to go for remote, for example, that means we start having to scan a new set of things. And that's where the task force really comes in handy. Whenever we looked at putting together a task force, we wanted it to be big enough that we had people to talk to, colleagues to talk to wrestle with issues so that we could come to conclusions. We have 5 people on ours. But we wanted it small enough that we would be able to make decisions fairly quickly, divide the work up, and be able to take action. So we identified that small group of people. They're all decision makers within the organization. We have enough both time with the organization and sort of social capital inside the organization to be able to make decisions and get help and enlist others so that we can move things forward. We are using the loop that I just described as a part of making our decisions. And we also are very aware of the fact that in this kind of a situation, our decisions may change. What we decide one day may have to change the next day, and that's okay. But because of that, a big part of what we talked about and set up initially was how we communicated the decision to our stakeholders, boards, our staff members in different audiences. And this is a place, all of these are places where we found technology particularly helpful. So we were able to use online collaborative document to work on a communications document that described the policies and the policies for each office. We were also able to work on frequently asked questions guide to support managers as staff came back to them and had questions. We worked on that. Once we decided we were done, we put it into a new document and made that document available with our staff. I will say, just as a side note, we made the decision not to make our working copy available because we're thinking about it and commenting on each other, and we didn't want it to feel confusing when other people looked at it and could either see those comments or look at the version history. So we try to make sure the staff's version is a pretty clean version so that they can be really clear about what the decisions are. We obviously are using tools like Zoom and Google Hangouts and Teams to be able to meet and communicate. We've made it a priority on the task force that when we communicate, we have our video on because we find it helpful to be able to see each other's faces, both because this is a changing situation. We're making hard decisions, and it's comforting. It reminds us all that we're human, but also so that you get all the visual cues of talking to a person that you can lose whenever you're not in person and you're just doing things online. And one of the important parts that we've had to deal with is identifying the dimensions across which we need to make decisions. So we knew, for example, we needed to make decisions about remote work. We needed to make decisions about travel. We needed to make decisions about in-person events, those we were attending and those that we might be hosting. We had to make decisions about service delivery. I want to pause here to say that service delivery in our instance is a little bit less complex because so much of it already happens online. And one of the things that we have been wrestling with inside our organization, and honestly, one of the reasons we wanted to have this virtual workshop today is understanding how service delivery is changing for nonprofits, organizations that provide shelters, for example, that do home visits, that run peer groups. Their service delivery is knotted up with in-person activities, and it's not nearly as easy to make virtual. So I'd encourage you all as you go through this, as we go through this presentation in the chat, tell us the things you're struggling with, because one of the things that we want to find out is where this is impacting you, because we want to know what we can do to help. Whether what we can do to help may be about writing articles that are tips on more sophisticated use of certain conferencing tools, or how to set up permissions on shared documents so that you can use them in different ways. But you're going to have many more things that you need, and we want to respond as much as we can to your needs. So I'm going to hand it off to Cameron, and we're going to talk about a few of these things, starting with remote work.
Thanks, Marnie. Yes, so again, please do chat in other areas or questions that you have related that are not specific to the ones that Marnie just listed: remote work, travel, in-person events. I also have seen this question come through in the chat a couple of times, whether this webinar is being recorded and whether we will share the recording and the slides afterwards. The answer is yes, we will. So don't panic if you have to drop off early. You and everybody who's attended will get a copy of the slides and the recording. So first of all, when we talk about remote work, obviously this is one of the most frequently discussed topics that we've seen as we've been talking with other nonprofits around this pandemic and how people are responding. This is not only nonprofits, the for-profit sector is everyone's grappling with this and trying to figure out what to do. And there was actually by a journalist who had the experience of being quarantined and working remote for both the SARS epidemic and now this one. So in terms of thinking about remote work, and as you form your task force and start to grapple with how do you help employees, or whether you should do remote work and who should do remote work, so these are the three areas that you need to sort of figure out. So first you have to figure out what your policy should be. Do you have a work-at-home policy or a remote work policy? And the purpose of having a policy is really to ensure that both the employees and the organization will benefit from these arrangements, and that it's really clear what the guidelines are. The second part of a remote work policy is really the scope. Who does it apply to? Does it apply to absolutely everybody in the organization, only a few people in the organization, or a few categories of staff, and why? Laying out your reasoning and your thoughts behind why certain people might be able to work remote and others is going to really help in the communication of the policy. Time frame, is it a permanent policy or is it a temporary policy? Is it, I know TechSoup has our own, we already had a remote work policy because we do have staff that work in other parts of the country and are not in the office. And so sometimes our policy relates to, it addresses both people who are full-time remote and people who only come into the office 2 or 3 days a week. So we have that component to our policy, and it also kind of outlines the situations and the conditions under which people are permitted to work remote. And then the working requirements of the policy. What are the working hours? I know for myself in the last week of working remote here from my home in California that I sometimes will look at the clock and it's suddenly 8 o'clock at night and I have, it feels like I've been working all day and I don't have a great way to figure out the separation of time. So having an understanding of what the working hours are and should be for staff, for both, so people understand when others are available and then understand when, to take some time off and do some self-care and some, get out of the house and go and step away for a little while. What are the reporting or check-in frequency that you should set up between managers and staff? And what's the process for that? Is it, sending an email? Is it having a face-to-face conversation over video chat? And what are the technical requirements that you need to support some of those policy decisions that you've made? So the ability to work without distractions, the ability to video conference, to connect to the internet, and the ability to adhere to other policies that you have in your organization. You may have data privacy policies, social media policies, confidentiality policies, and how does that remote work policy affect staff's ability to adhere to those, and what do they need to do to adhere to those policies? So that's the policy portion. And then preparing to allow staff to work remotely, you have to think about the inventory of equipment that you have, who's got what hardware, who's got what laptops, headsets, whatever it is that they need, and how are you keeping track of who has what, and what technologies you need to support remote work. I've seen a couple of questions in the chat about, well, what if people don't have internet access at home? And, I think that's probably the number one question I've seen come through about how people can, what do we do about this? Our staff doesn't have internet connectivity at home. And so there are solutions to that. Obviously, there are places like public libraries, if they continue to be open, that often have free Wi-Fi. There are also internet hotspots. TechSoup does have a program called Mobile Beacon that distributes mobile hotspots, and I use one myself actually when I travel, that are great for connecting from pretty much anywhere. But what other technologies, you have to think about what other technologies you need. So a VPN, internet access, obviously, laptops, video cameras. Not everybody, we discovered as our staff went remote, not everybody had video cameras on their laptops. Some of them were running older computers that didn't have that. And so is that needed, and do you want to supply that to your staff? Headsets, printers, scanners, the ability to sign documents while being remote. All of these are things you need to think about what the staff are going to need to support their remote work. And then also, as Marnie pointed out, you need ways of collaborating and communicating on the decisions, on these preparation decisions as you make them. So she mentioned that we have an internal document that the task force uses to make decisions and think about things, and then the external to staff document that communicates what those decisions are. And then lastly, the tools, as I mentioned before, there are lots of different tools Some are available through TechSoup, some are available direct through technology companies. And, you know, we've seen a lot of technology companies step up and make specific offers available to nonprofits as a result of the COVID-19 pandemic. And so we'll be providing information on those as we understand and learn about them. But in terms of document sharing and collaboration and communication, both for your task force and for your staff generally, there are cloud-based document repositories that allow your staff to communicate and collaborate from remote locations. There's Box, obviously, SharePoint. If you're using Office 365, SharePoint comes included in that package. So that's a great option for organizations that are already running Office 365. Dropbox is another one that I know they have a special COVID-19 offer now, but they're also kicking off a special nonprofit offer through TechSoup, I think in the coming weeks. And Google Drive is another one. Google for Nonprofits has a special offer for nonprofits that you can get, and you can use the Google Drive for sharing both Google Documents or Microsoft Office documents. So those are the tools that we see organizations use the most in terms of sharing documents and spreadsheets, or documents and spreadsheets that you can use to work on Google Docs and the Office suite. But Facebook also has Workspace, which is another one that you can use. So there are a lot of different options available to nonprofits. And then I wanted to make one mention quickly about folders and secure folders policies. So when we have set up our box folders, we generally think about 3 different folder types at a broad level. We think about internal only, so internal to staff that is available to all staff. Then folders that are externally open to external parties, whether that be board members or constituents or the press or whomever it is that you're dealing with externally outside of your domain. And then internal confidential, so those folders that are restricted to a select group of either decision makers or high-level staff that only they can access. So that's what we've been thinking about in terms of setting up folders. And then, as I said before, for staff for remote work, laptops, headsets, monitors, video cameras, mobile access points, and VPNs are all devices that you're going to need to think about what your staff is going to need to work remote. And a lot of these are available a lot of options for these are available through TechSoup. We did a blog post last Friday, which lists a bunch of these, and we'll be adding to that as we go forward through the next couple of weeks as we understand more information. The question for everybody on the line, how many of you already have a remote work policy? Be interesting to understand that. Often organizations will have a policy that was drafted years ago in response to a specific case, and now you need to update it. But so I'd love to.
You should see the poll now on your screen. So please answer there.
Oh, wow.
Responses are coming in.
A lot of people already have a policy. That's fantastic. That's great to see. So maybe, I know we already had a policy. Marnie, I think when we started to look at remote work for our staff, did we have to do any adjustments to our policy?
We did have to do a few adjustments, mostly to around equipment. So as I mentioned earlier, quite a few of our staff were using desktop machines. So we had to get those staff laptop computers, headsets, monitors, and in some cases, internet access points to augment what they might have at home. Also, you know, we have staff in a wide variety of living circumstances, so we checked in individually with people to make sure that they could work from home, not just from a technical perspective, but also from the perspective of having a desk and a quiet space And we realize that this is one of the places that's going to be changing rapidly as schools close, as people that may have family members that they have to care for. It's going to impact their ability to be able to work in the way that they're used to, because they may have children at home. They may have somebody that they need to care for. So we're just making sure that we're keeping in close contact and adjusting as is necessary, so that we have as fair a policy as we can have. And but we're not forgetting that these are all human beings that are also stressed and dealing with this, and so we're trying to be as supportive as possible within the policy. So we needed to do the remote policy. We had to come up with a new inventory form, so we made sure we knew who was getting what equipment, and and actually, frankly, support them in getting home. So we used shared lift line rides and things like that to help get people home with the equipment, so that we really we're making sure that they weren't, sort of getting on the bus with a monitor, a headset, a laptop, and a desk.
Yeah.
So that's been a part of our. That was where we had to make the adjustments. Where most of our, we have other staff that has laptops all the time because they travel a great deal or work outside of the office, like both you and I, Cameron, work outside of the office a great deal. So that staff was more prepared to be able to work remotely in terms of the equipment and the policies.
Yeah. Great. Well, I see from the poll result, it looks like the majority don't have a policy, although people do work remotely. So this is a good time to think about putting something together, at least bare bones in terms of some of the pointers that we've talked through here, and just make it clear. It also looks like, obviously, we're going to have a lot of organizations that their work is such that they can't work remotely. So yeah, that's always a challenge, and we'll touch on that in a little bit. So next hot topic for everybody is travel. Marnie, you and I have both had a lot of experience recently with wrestling with how we deal with travel. So I'll hand this off to you.
Sure. So, the things that we've considered when we've made decisions about travel as an organization is where do we have people traveling to? Are they traveling? Is it inside the country in which they are located and a passport holder? Are they crossing national borders? Are they traveling around by train or airplane? And part of our consideration has been, particularly in the early part of this, was making sure that our staff was able to get back home, that they weren't in a position where they might be quarantined because of where they were coming from, or in a position where traveling back would be hard, either because of quarantines or restricted ability to cross borders, or simply because as the demand on airlines is decreasing, they're not offering as many flights. So we also didn't want people stuck for logistical reasons. So knowing the locations where you travel is important. As I've been looking at the chat, many of you are also traveling around your region or area to deliver services because you provide home health care, or you do, outward work. And so your travel is wrapped up with your service delivery, and that gets into what's essential. We very quickly cut all non-essential travel, which for us is most of our travel, if not all of our travel. But some of it was travel that we were doing in the service of grants and other things. So we had to be clear to communicate back to funders if that travel was impacting our ability to perform on a grant. We had to change the way that we did some of the work or the events and reschedule some of the work and events. But for some of you that are providing frontline services, the travel is going to remain essential. And there that's a place where I think the task force is going to end up having to spend most of its time. And many of you may choose to include boards, members, or other outside advisors on your task force, because you're going to have to make decisions about the safety of your staff and the people that you serve much more rapidly, and it may be more evolving. We're starting to see more guidance come out. One of the links that we'll share as a part of this is from the CDC, and it is specifically the Center for Disease Control in the U.S., and it is very specifically guidance for community and faith-based organizations that starts to get into that. And I think you're also going to have to work when it comes to essential travel with your county and state departments of health to understand what the best practices are and get support. One of the other considerations, so that what's essential is a knotty one and is going to get into service delivery. Acceptable travel modes. So I think this is very much for organizations where you may be traveling around by a car, you may have shared vehicles or buses that you need to use. Obviously, thinking about what you do about plane or train travel, requirements to be on public transportation. Again, I think that's going to be very knotted up with the guidance that's given by, depending on what's going on in your specific area, the guidance that's given by your public health communities. Part of the CDC guidance is very clear about those kinds of shared vehicles and shared spaces, the ability to wipe them down very thoroughly in between individuals' use. And there's a lot of online guidance about cleaning and how to clean things. And then, looking at alternatives, and that's been a lot of the conversation that I've seen in the chat. How do you better use virtual tools to be able to perhaps do some of the things that you were doing before? And really think about, is there an opportunity? We may not be able to get rid of travel because there is parts of it that are essential to us delivering our services, but all of those, how much can we really move into alternatives? So I'll give you an example. One of the pieces of teleconferencing software, Zoom, Cameron mentioned it earlier, it's one of the products that's available on TechSoup, actually has more sophisticated features than many of us use, including the ability to put callers into breakout rooms, and so that they're having conversations amongst four of them, the ability to use whiteboards and other things. One of the things that we'll be doing as follow-up to this is producing and sharing more content with you about how to use those kinds of features, so that it may be that you can say, okay, we have to do this kind of travel over here, but we're going to restrict what used to be drop-in meetings, and we're going to see if we can move them online and use tools like Zoom to be able to manage them in ways that we did previously. That brings us to another poll question on whether or not travel is essential for your nonprofit organization.
Marnie, there was one other point I was going to mention about travel.
Sure.
We've seen questions from people who need to travel to places for personal reasons, or they happen to be there already on vacation and then need to come back. And how do you? I was talking to somebody yesterday who had a staff person who was on vacation outside of the country in Asia, and when she comes back, it's a frontline staff person that needs to be in the office. And she was saying, I think I'm going to have to quarantine her for 14 days. And that means, I'm going to be without that person. So, these are considerations to think about and be aware of, is that you have staff that may be taking personal travel to places that may require that they not come into the office or not come into your space following that travel for a period of time.
Yeah, good addition, Camera. That's absolutely right. We have not done anything in our policies to restrict people's personal travel. We have asked them to self-isolate when they come back, and we have been increasingly taking into consideration that we may lose choices about some of those quarantines and isolation. Some of those things, as we saw with the cruise ship, actually. Those were people on personal vacations that are being quarantined in military bases. And we just have to be prepared for that. And I think that's a place where you have to, the cultural fit and tendency of your organization, has to play a role. But we are, I will say we were pretty conservative in our response. We moved to remote work as soon as it was reasonable for us to do it. We canceled travel fairly early on, and we have done a lot of communicating with staff about the situation in which they can make the choice to self-isolate. So we're getting the answers back. It looks like the majority of folks, 55%, mostly just use travel for conferences or meetings. As many of you are seeing, those conferences are being canceled. They're being changed to virtual conferences. And those meetings are being canceled or moved online. We've seen a huge postponement of meetings across the sector. We're also starting to see a slight uptick in people moving those into online fora that look like Google Groups or instances of Slack, so that they're trying to reproduce the informal networking, not just thinking about how they make the sessions available. And I think that leads us nicely into Cameron, if you want to talk a little bit about in-person events.
Yeah, sure. Many organizations are struggling whether to go ahead with hosting or attending in-person events. This was a big kind of question mark a couple days ago. I think it's becoming more and more clear as the days go by and events are just being canceled. I talked to somebody a couple days ago, and he was saying, all of my decisions about whether to attend are being made before me because everything's being canceled. And that is really true. Often you'll get the decision made for you either by the event people, or if you're hosting your own event, officials in your area may be providing guidance around gatherings. So, for example, the city of San Francisco has banned gatherings of 1,000 people or more. That being said, I think that people are even being more conservative than that. And, we've seen all the NBA games are all being canceled. I know, much to my son's unhappiness, but there is, there's a lot of questions around these events. And I saw in the chat that NTC was canceled. I don't know if that's true or not.
Yes,
the Nonprofit Technology Conference.
They canceled late last night, actually.
Oh, okay. Yeah. So again, many of these decisions are being made for us, but there is, we did find a resource which we'll curate and pull together and make available as part of the resources after this event. But I was looking through it last night, and people were trying to collaborate on different ideas around ways to substitute for your in-person events. So obviously, as Marnie mentioned, there are online tools like Google Hangouts, Facebook Live. If you're on Office 365, Teams is a really great option for collaborating and having events that are more internal to your organization, or Slack. And then, as we've mentioned several times, Zoom is a great tool also. But some of the ideas that I was just looking through this resource list, and you can have, if you're supposed to have a gala, maybe you can have a virtual gala where you sell, instead of selling tickets to an in-person dinner, you're selling a dinner that you get delivered by a local restaurant that you mark up, and that additional markup comes to your organization, or you're delivering food baskets or goodie bags that replace that kind of that gala event. Holding obviously online raffles or auctions. I know a lot of schools and libraries will have online or in-person events where they do big fundraising, and there's a lot of this is available now to do online, and you can have it be online live, or you can have it be sort of over a period of days. But that's another option. You can also raffle off ways, the ability to name a conference room in your organization in exchange for a donation to your organization. Obviously, for more kind of programmatic in-person events, those virtual meeting tools are really useful. So we use Zoom a lot at TechSoup. It's kind of fun because it lets you customize your background, so you can appear like you're at the Grand Canyon or you're in outer space. And I know our staff, we've got a couple staff that are really into that idea. So, but in terms of service delivery, so when you have, and I did see in the poll earlier, there are a lot of organizations, in the poll around remote work, there are a lot of organizations where the nature of their work is such that they can't move remote. And so what kind of decisions can you make around the service delivery? And Marnie touched on a couple of these, but what if you have meetings with constituents that in human service organizations, is there a way to make those online so that you can do them over a face-to-face video chat rather than having people come in and have to travel on public transportation and come into a space? And then how do you, if you do have people coming in, or if you do have people working in your space, how do you minimize risk to staff and program participants? And part of that is about keeping your space safe and making space so that not everybody's kind of crowded together. And then how do you also think about changing the way you use volunteers or community support? Do you want to have volunteers come in, or do you want to have them, is it something that they can do remotely, and under what conditions, and what are the risks associated with that? So, and another idea I saw online is, how can you work with other organizations to deliver services that you need to do in person, and partner with organizations to try to leverage each other's strengths. So maybe maybe your own space is not suitable, but maybe there's another space in a church or a community center that you can use, and you can collaborate together to try to solve some of these in-person the need for in-person or live events or engagement with your community. So again, the CDC website, I wanted to note, has some great guidance, and I think, Nicole, you have some links that you can share in the chat around this. They have guidance for community and faith-based organizations on how to think about service delivery and keeping themselves, the staff, and their constituents safe. And then there's also a specific guidance that we called out for homeless shelters, which was sort of interesting. So there's a link for that too, which I think Nicole will be able to provide in the chat for you. A lot of information on the CDC around this, which is super helpful. And again, tool options, I think we've covered a lot of the tool options related to this, around document sharing, video conferencing, cloud-hosted servers. So a lot of organizations, specifically human service organizations, will have client management systems that are hosted on servers in their organization. This is, obviously it's not something you can do right away. It's not a quick process, but you might think about trying to move those into the cloud at some point, get them out of your physical space and into the cloud so that people can access them from remote locations more easily. The next piece I wanted to talk to is around service delivery and considerations for your physical space. So we have a fantastic office manager at TechSoup who was on this weeks ago, setting up hand sanitizers, making available disinfectant wipes to really clean things down, and then also really communicating to the staff what you're doing and your constituents what you're doing about cleaning your space to make them feel more secure. I was traveling actually when a lot of this stuff broke out, and I got a note from my hotel saying, we want you to understand what our cleaning staff are doing in your room when they come in to clean your room. They're wearing face masks, they're putting on new sets of gloves, they're cleaning everything with new rags, so and that provided me with a lot of peace of mind. And so communicating out to your staff sort of what's happening around keeping your space safe and germ-free from this virus is really going to help people psychologically. There's a lot of stress, a lot of mental stress around this COVID-19 pandemic, and people worrying about not only their usual stuff that they worry about in their day-to-day life, but also touching things, touching your face, worrying about the person who's coughing over in the corner. So giving people a sense of what you're doing to keep the physical space safe for libraries, museums, community centers, anything that's kind of open to the public. That's really an important and helpful piece to make sure that your organization is doing. So with that, I'm going to hand back off to Marnie to
Cameron,
discuss.
I want to add one thing
Sure.
to the thing about service delivery, and you touched on it, but just to emphasize, for people that are offering shelters, the CDC is putting out more and more guidance on it. I saw even between yesterday and today that their guidance has been updated, and a key piece of it has been to think about how you can isolate individuals within a shelter. Do you have the ability to provide people with a safe space to be, but keep them separate if they either show symptoms or, in the chance that they've tested positive? And for any of you that have been around a hospital or a few other places in the last couple of days, you may have seen hospitals preparing for the same kinds of things, the ability for people to come in, and that may include a door that's reserved for people that may suspect that they have been exposed or in fact that they have the virus, or as well as separate waiting rooms. And that's not to suggest, of course, that they don't deserve and should get the same services, but do you have the ability to segment off so that you can still provide services without potentially exposing everyone? So the guidance on that is getting more and more robust, specifically for people that are operating shelters.
Yeah, great point. Thanks, Marnie.
Sure. So the next part is, as you go through and you're making and wrestling with all of these decisions, how are you recording them, and then how are you notifying people? And because it's so evolving, I'm just looking at the links folks are sharing in chat. The state of California today, someone was sharing, or yesterday, someone was just sharing, issued a definition of what a gathering is and how they define a gathering. We're seeing more and more in our communities that San Francisco has banned gatherings, I think, of anything more than 1,000 people. Another county here in the San Francisco Bay Area has banned gatherings of more than 50 people, except for schools. So that, we're seeing these things constantly evolve, and that means that your decisions are changing. They're changing because things may be being made for you, because your staff's availability is changing. So that's sort of part of why we're separating notifying people from where you're recording the decisions. I think it is great to be able to provide a single link to people and say, we will keep this up to date, whether it is a shared document such as a Google Doc, whether it is a page on your public-facing website or your intranet. Having one link that people can return to and see updated information is great, because it makes it easier for them, and it means that they can proactively look at the information. They're not looking through email or text messages or Facebook messages or hunting around on the website to see if you've posted some new information or not. So for our internal purposes, for example, we used a collaborative document that we made available to staff, that we locked down editing and commenting on it. And we did that not because we don't want to receive comments, but simply so that it was very clear that this was the decision, and comments or edits from other people wouldn't make it confusing to folks whenever they looked at it. So we decided to find one place and have one link. And now, how did we communicate to people, and how are we communicating the changes to folks? We're using the habits that are ingrained in our organization to be able to communicate. We're a super email-heavy org. So we communicate by sending all staff emails. We communicate with our board by email and giving them updates and sharing things. We also organizationally are Slack users, so we have a Slack channel set up with this link pinned to the top of it so people can find it, and we're communicating changes there. So we're using a variety of methods to notify people that something is updated or changed, but in every instance we're saying go back and look at this one document because that's where you're going to see the answers. And if you're just worried that you might have missed an email or you might have missed a communication, you can go on your own to that document and see. And we're making sure that the top of the document, has the date on it. So we have the current view as of and the date, and then we have the last time it was updated, the date, and when it was originally published and the date, just to make it easier for folks to be able to go through and understand what's changed and what applies to them. And then we also, when we've made significant decisions, we've also had team meetings. We're a medium-sized organization. We have a couple hundred employees around the world. So we've had team meetings where we've had everybody come together using a teleconferencing system. As Cameron said, we're big Zoom users. Using that or using Microsoft Teams, actually both of them. We've used both of them. And we have everybody from the team come together. We've confirmed that they got the information. We reviewed it quickly. We gave people an opportunity to ask questions. And we made sure that they knew all the ways that they could ask questions, that they could ask questions by asking us there in that team meeting. They could ask questions by privately contacting their manager and asking a question. They could use a Slack channel that we set up for this instance to ask a question, and they could email the task force that we set up with a question. So we gave them a lot of avenues because we realized people aren't always comfortable asking in front of their peers. They might want to ask their manager. There's a lot of information in here that can be sensitive and feel very personal. So we really over-communicated our policy decisions. We communicated those decisions by email with our board. I think that I mentioned in chat, and I can't remember if I said aloud yet or not, we're going to be publishing a blog post likely tomorrow that both shares our policy and what we set up, but also communicates to our the individuals we serve what our intent is and how we're responding to us. For us, that wasn't as big a communication need because so much of our work is already virtual and online. When people call our help desk, they don't necessarily know where the help desk person is sitting. When we're answering emails, they don't know where we're answering from, and that's how we deliver so much of our service. That it wasn't our priority to communicate externally. We've decided to do it simply to let people know that we're continuing to operate and, just so that we start communications, because while we are working very hard to make sure our productivity and ability to provide services isn't impacted, we do recognize this as a changing environment and something could change or something could happen that changes that, and we want to have the communications set up to be able to do that with our constituency. For other people, the sharing with your constituency is, maybe one of the first things you have to do, because as some of you have been sharing, you've had to cancel in-person support groups, or you may be in an area. Somebody said hi from Seattle early on, and hi from Seattle in quarantine early on in the chat, and it could be that you're feeling an impact because your staff are more directly impacted, so you need to be more proactive in that external communication. That part of communicating, that is, like I said, the single URL so people can be proactive, and then giving people a lot of channels to be able to ask questions. We've also, I mentioned this earlier, gave our people managers a list of questions that we thought might come up, like, are people going to be told they have to take their vacation time? Are they going to be allowed to work at home? All the things that just might get asked to help empower those folks to be able to answer those questions in real time. And of course, they can come back to us with questions, and we'll continue to provide answers where we can. So the next thing up is another question for you. I'm pretty sure this one isn't a survey. Is that's correct, Nicole?
That's right. Yes. So in the chat box is how people can
Great.
answer.
Yeah. So if you can just let us know in the chat box, how are you communicating your organization's status? Are you putting it up in public on your website? I'll be honest. One of the things that we wrestled with in sharing it was, security issues. That's less of an issue now as more and more people are working from home. But we made some of those decisions early on, so we wanted to be careful with it. And so we did think about what that external communication looked like. I see a lot of people answering email and Slack. I really will, I'm going to double down on my recommendation that you also put the policy in one place that people can refer to, and you keep it up to date, because we certainly saw in our organization that some people just miss the email. They might not see it in a timely enough fashion, so that way we could encourage people to go to that document and see something that was updated. And I'm also curious, carrier pigeon, nice. I'm also curious how you're communicating with your board and others as well, and if you've had a lot of questions come in from your board about what they're doing or what their engagement is, because I think that is understanding how to get them engaged and how to have involve them in some of these decisions is a different challenge for different kinds of organizations. Putting things up on SharePoint, phone calls, posting around the office.
And as you mentioned earlier in this webinar, Marnie, the fact that this information is changing so rapidly, and so
right.
It's always, as you do these communications, it's really helpful to remind everyone, like this is what we're saying now, but everything could change in 2 days. And, there was a question in the chat that I've seen come through about dealing with kids that are being sent home from school, and how do you
right.
deal with that? So as schools close, as universities close, I have 3 kids in university, and they are all now headed home. And so, how do I deal with that? And, and my work and everything else. So understanding that things change rapidly and day to day, and make sure that everybody understands what we're saying today is the policy may change tomorrow based on a whole host of things.
Yeah, absolutely. And it's a situation which people don't know what the right answer is, and it's going to change in your community and depending what the service is. So a lot of what we put on top of that communication that we're delivering to folks is this is our current view as of this day and time, because it is a view and it is going to change. And I think that puts us right into going back to that decision loop I talked about earlier: observe, orient, decide, and act. As rapid as everything's changing, and as rapid as the information, you have to have the time to go back and reflect. So it's after you've made a set of decisions and act, you have to start observing again, and that has to include a moment of reflection. What's working well? What's not working? What do you need to change? Is there something you need to stop? Is there something you need to start? And that may happen because, as Cameron was just talking about, the external environment changes. Staff is less available because they have young children and an elementary school is closed, because you are under county health mandates that are dictating some of what you can or cannot do, because of some of the things you're dealing with and the health issues you may be facing with your own staff and the populations with which you work. The ability to to take that and pause so that you really are lifting your head up and looking around and saying, okay, what are we observing now? How does this change how we orient ourselves? And then go, does that mean we stay with the decisions that we've made? What do we have to change? And then acting on them. Whenever they talk and teach this particular loop, one of the things that they talk about is that you stay and observe and orient as long as you possibly can. And then once you decide, you act as rapidly as you can. And it's so you're maximizing the amount of incoming information, making the decision and acting. Of course, you can't wait too long to make that decision because then you could have another set of dangers. But the ability to hold tight and really observe and have that time to reflect is helpful. As we started having people work from home, our focus, for example, changed from what do we have to do to get them ready to work from home to how do we staff a help desk, because our help desk is sort of set up to mostly help people that are in the office. And, this is putting a different tax on those individuals. So how are we helping them triage and supporting that, anticipating that calls may come up? So that's an example of where our decision and action made a new set of circumstances that we had to observe and orient ourselves around.
Hey, Marnie, there's a fantastic back and forth going on in the chat a little bit between Lisa and Karen on dealing with the board and communication, and then some other questions around external parties on the task force and who did you bring in, who did you consult with externally, and do you include the board? And somebody was commenting about the fact that they're getting so many opinions and people are volunteering what they should do, and it's overwhelming.
Yeah, so every organization is going to have to make some of those decisions for themselves, obviously, because it depends on how active your board is. And this is a place where, so in our instance, a board member was not on our task force, but we communicated with them both by sending them emails and having phone calls so that we were able to bring their opinions into the task force, but they weren't necessarily in the task force meeting. So, that I think that can be the charge of one individual of the task force is to communicate with a group like the board. Another charge may be to communicate with some funders and be able to bring, depending on your relationships, and be able to bring those comments in. We have actually worked hard to kind of reduce the decision-making noise. So we are looking at resources like, things from the CDC, things from the World Health Organization. Johns Hopkins has a lot of good information that they're putting out. Some of the communications that are coming from businesses and taking some of our cues from the decisions that they're making. But, I mentioned earlier, we have some internal Slack channels where people are sharing information, and they're sharing a lot. That channel is very noisy. People have strong opinions. We've gotten some of those strong opinions in email format. I'm not saying that we're ignoring them, but we're acknowledging that we may not be able to respond to every one of them, and really trying to keep that noise to a minimum so that we aren't overwhelmed and we can make the decisions we want. And where we're looking at staff opinions and everything, what that's really informing is a little bit less the decisions. I mean, of course, it's a part of our decisions and staff comfort level. It's much more informing how we're communicating the decisions and the options we're engaging for people. So as we saw our staff start to get nervous, even before we said we're going to strongly encourage everybody to work remotely, we were letting people remote work whenever they asked, and all managers knew that. So, part of the reason we've been really proactive and over-communicating and proactive in our decision-making is actually to help reduce some of the noise and churn that's been coming in. And I know that's going to be differently possible for different organizations, but I do think that this is a place where communicating outward, giving people channels for asking questions so you don't have to be interrupt-driven, because that's, for me anyway, that's what starts to get stressful when I make other people's urgency my own and it's interrupt driven and you're getting it coming at you from all directions. So that's why we said here's some clear channels for communicating. On those of us making the decision on our side, it means we have some ability to know when we're engaging in those channels, be able to set aside the time and look through them. And then we have other colleagues that are receiving much of the same communications on the task force. So part of what we get is the ability to talk to each other, but because it's hard. And in fact, that is a big part of it. I mean, it's hard and stressful because it's hard and stressful. This is information that's changing. We don't know what it means or what the outcome is going to be. It is stressful, and we have to acknowledge the stress that we're under and the stress that our colleagues are under. And we have to make time for that part of real life, both the sad and the goofy parts. So we are checking in regularly with our staff to make sure they're doing okay, their families are okay, that we're not forgetting that they're, as Cameron was talking about in our own circumstances, she's getting communications from colleges about her children. We're all operating in this environment that's our lives, and so we're doing the best we can to acknowledge that and check in with people, obviously being careful about people's privacy and all of those kinds of things, but making time for that, and also making time for some of the goofiness. So we, because we're all working remotely and we're not seeing each other at our desks every day or many days, a lot of our teams have started checking in every day on Slack at the beginning of the day to see what they're doing. And some of our teams are doing things like sharing photos of their coffee cups and their home desk setup and those kinds of things, so that they're maintaining some of that connection with each other. And I think it's okay. It's also okay to have those places where you can have a little bit of stress relief. I think that and tools can help with that. I said that because I helpfully saw that it was on the slide. Tools can help with that. Things like Zoom and turning the video on. Tools like Slack that allow for informal communication and channels of communications, so that people can have a choice of whether or not they want to engage with things or not. All of that is a part of keeping your team together, and what many of us do, even if we don't think about it, at staff meetings or when we just talk to each other in the hallway, or ask each other questions or share some story about our kids or our home life with each other. I think it's okay to look for ways to sort of keep that going and present with people. And so I think that's great that I just saw somebody shared that they created a Teams thread for pet photos. I mean, that's a colleague that works for Box.org actually tweeted the other day that one of the unexpected benefits was seeing everybody's pets on the video, seeing their pets in the background. And so all of that is part of it. We've even talked on one of our teams about one of the teams that I work with every other week having like coffee dates, just setting up coffee dates with each other the way we might watch coffee, or having an hour where we're checking in and we have Zoom on, but we're just working just so we can see each other and we can ask casual questions, because that's what how do we replicate that casual interaction that makes us feel connected, and being able to do that, and also looking and seeing are there opportunities for you to do that with your constituency when you can. So just keeping that part front and center is also helpful. Cameron, do you want to talk a little bit about what we're doing next?
Sure. So I mentioned that we had posted a blog post last Friday on COVID-19 and sort of tools for organizations that they can use, that you all can use to kind of quickly, and our emphasis for that post was really tools that you can quickly and easily get set up. It doesn't require a big project or a big consult. And so that we're going to keep updating that with additional resources. a lot of fantastic information and ideas in the chat here, which we will go through and consolidate. We have over 700 people on this event today, which is amazing. I think this is maybe a record for TechSoup, and lots of ideas. And so we'll be spending the next day or so going through this and collating and curating information, and we'll be adding. We decided we're going to just keep adding and updating that specific blog post with more information. And some of the information and resources that we want to continue to provide you, obviously, any additional places to go for guidance on how to think about things. And there have been some great sharing of CDC resources in the chat. How to make policy decisions and policy templates. So we'll be looking at curating some things like that. I know a lot of people have asked for remote work policy templates that they can work off of for their own organization. We're happy to share something like that. And then, the technology tools. I realize, here I am the head of solutions and services, and I neglected to mention some of the services, again, because our emphasis has been on things that help you move quickly. But we do have full services around email migration, setting up SharePoint, setting up Box for your organization if you don't feel like you can handle it yourself. We also have our TechSoup Courses program, which has a lot of free courses on how to use some of these tools, how to use Teams. If you're in Microsoft Office 365, how do you use Teams? What is SharePoint? How do you use it? How do you use OneDrive? So a lot of free courses available on these tools that can help you and your staff get set up and using it quickly. And then we'll be posting other thoughts and considerations. And one of the questions to bounce back really quickly to the remote work, I did neglect to mention, and I've seen this come through in a couple chat questions. What do you do about snail mail that's arriving at your office? And I've seen this question on a couple of other forums, and I know one foundation that we talked to, they were worried about how they were going to get checks distributed. So they sent somebody home with a printer and a set of checks in a locked box, and gave them authorization to distribute checks. And I think we've done some of that too, Marnie, right? We've sent our accounting team home with checks, and that we have people checking in on the office for mail that comes in with checks that come into us.
That's right. When we've been able to redirect mail or do things like that, we have. Otherwise, we have mechanisms for getting the mail. And right now, we're still able to have some staff go in and check in the office for mail so that we can take things. But we also acknowledge that there might be a point at which we either have to do a mail hold. The mail simply may be held. Again, that may be something that ends up not being our decision. So we're going to have to be prepared to play catch up there. And then as somebody just shared online, for some of you, you may be able to do some online bill payments and, decide to update your website to strongly encourage people to donate by mechanisms that aren't checks, or to pay for and engage with services in other ways if that's possible.
So a couple of other resources related to thinking about your organization and COVID-19. Our friends over at Tech Impact and 501 Commons, other fellow nonprofits that work in helping nonprofits with their technology, they have a webinar next week. So as we said, this information keeps changing. So if you want to tune into their webinar, you can get some. I'm sure they'll have a lot of updates to what we've gone through here. And they're primarily service-related organizations. They're our partners in delivering a lot of technology services, and so they're going to have some tips and tricks for you on how to get some of these technologies set up for your organization. There's a coronavirus tech handbook, which I think Nicole can share that link, and then, of course, we'll be sharing all this after.
Stephen just shared it in the chat, too, and we'll be sharing.
Thanks, Stephen.
And we'll be sharing it afterwards as well.
Yeah. There is also a Prepare, Respond, and Serve webinar, also hosted by Tech Impact and 501c Commons, that's going to be available. And then there's a great article from the Harvard Business Review that's obviously focused on businesses, but it's a lot of the guidance in that is really helpful to nonprofits. We used some of that in thinking and putting together this webinar today. So, and then my colleague who manages the TechSoup Courses program reminded me that the TechSoup Courses team in literally the last 2 days have put together a special set of courses, like a course track on preparing for COVID-19 and some specific courses that are related to that. We've done a recent disaster preparedness set of courses, and so they've curated some of that specific to this situation. So that's another great resource, which I don't think Stephen has a link to right now, but we can share that out afterwards as well.
Yeah, we'll be sure to share all these links. There's lots of great resources too, and do our best to consolidate all the chat resources that was shared. So just wanted to thank Marnie and Cameron so much for putting all this together, for Stephen for assisting with links and chat. We do have about 7 minutes here, and I know there's a whole lot of questions. Marnie, Cameron, are there any ones that you really wanted to tackle?
I did see a couple of libraries responding to my earlier comment about in the remote work section where I had said libraries often have wireless networks that people can get on for free. Obviously, libraries, many are thinking about closing. And I had also mentioned the Mobile Beacon Hotspot program that we have at TechSoup. That program is specific just to nonprofits and public libraries. And I know we've had a lot of public libraries participate in that program and then use those hotspots to lend to constituents that need to have access to wireless from their home. So, like lending a book, they're lending a hotspot for a period of time. So, yeah, so that is definitely an option for libraries.
Great. All right. Any other last thoughts or questions you want to try to take on? And again, we are going to take everyone's questions and comments. We are going to review them. We're going to use that to help guide future content, be it articles, webinars, and so on. So really all of your engagement today has been incredibly helpful. So thank you so much. And I can wrap there, Marnie and Cameron. I'll kind of finish and close out.
Well, I had one other thing that I was going to raise.
Sure.
That I saw people asking questions about sick time and how do you deal with
the good ones.
Staff that are on sick time. And I've seen a couple of organizations talking about pooling sick time, having employees contribute to a sick time pool. I know that I myself have a ton of sick time kind of stocked up. And, I'd be happy to contribute some of my sick time hours to staff that may be brand new to the organization and haven't accumulated sick time yet, or people that have just come back from, parental leave or family leave that they need, additional sick time if they do get sick or if they do need to be quarantined. So, but yeah, that's again, a lot of organizations are going to have to make the decision for themselves what makes sense, if they just grant people sick time in this extreme situation, or if there are other ways for them to facilitate and support people.
Great. Thanks for that, Cameron. And continue to ask your questions, share your comments in the audience chat. We will be looking at all of those. And if you can share one thing that you learned in today's webinar, I'm sure lots of different things come to mind, but maybe one or two takeaways that you are ready to bring back to your nonprofit. That really just helps us know what were some of the biggest points for you. And again, some content that we should focus on in the future. And also, if you can help us. Yeah, go ahead, Marnie.
I was just going to say the other thing that I wanted to bring up, and I shared the link in the chat, is we do have a page on TechSoup for, we have a pretty robust disaster preparedness guide. And obviously when we're talking about disasters in that guide, we're often talking about things like, tornadoes and fires and hurricanes, disasters more of that nature. But this, a pandemic clearly falls in that. So there are, while a lot of that guide is set up for preparation and something you would have started a while ago, it is going to have some checklists and templates that are helpful. And we're in the process of updating that information and making it available, and we have some courses on that. I think one of our tasks to do is to go back through that guide and say, okay, what can we pull out of there that may be more immediately useful to people based on the comments so that you can get to it a little bit faster. But I do want to emphasize that some of those disaster planning things that you've undoubtedly seen or gone through that we've produced, that other people have produced, are going to have some sample policies in them. We'll be curating them and sharing them, so it's easier to find them, but that's one good place to look for some of those things.
That's right. Yeah, thanks, Marnie. And again, we'll be sharing all this information from today's webinar, and also some of the great links and resources that you shared in the chat, and a post-event webinar email. So look out for that. That'll be hitting your inboxes within the next 24 hours, in addition to a link with a recorded webinar, so you can go back and watch and share as well. Please, anyone who was unable to attend, please share this webinar with them. And with that, I see some really great feedback in terms of some of the top things. I see the Odo loop coming up quite a bit. So thank you for sharing some of your top takeaways there. And lastly, our post-event survey. Please, before you leave, you'll get prompted to fill out our post-event survey. It's just a couple of questions. It'll take you a minute. That will also really help us and guide us in terms of future content that we should be creating. So thank you. And again, follow us on Twitter. We're at TechSoup. And any other takeaways, continue the conversation with us with the hashtag TSWebinars and COVID-19. All right. And with that, I just want to thank everyone. Thank you, Marnie. Thank you, Cameron. Thank you, Stephen, and the Global Meet team.
Thanks, Nicole.
Thanks.